Hey guys, Doc Heps here, and thanks for watching. So you've gotten your PSA checked a number of different times, and they're all different. What's going on? A very common scenario amongst a lot of men, and we're going to dive into a little bit about what PSA testing means, how it affects you, different things that might affect the PSA, and I'll give you my algorithm for what we do with PSA testing. What is PSA? PSA stands for prostate-specific antigen. It's a protein that's made exclusively by the prostate. It's found in high concentrations in the ejaculate fluid, and basically it helps the sperm fertilize the egg. That's the purpose of that protein. And what happens is some of that protein, some of that PSA naturally leaks into our bloodstream, and that's how we pick it up. Now, the thought is sometimes in prostate cancer cells, those cells will leak more PSA out, and we find it in higher levels in the blood. PSA elevation doesn't necessarily mean you have prostate cancer. There are a number of things that can elevate the PSA that don't have anything to do with prostate cancer. So trying to tease that out is sort of the urologist's goal. The PSA is not totally reliable. You can get different results. It's an inconsistent predictor of prostate cancer, meaning that men can have an elevated PSA and it has nothing to do with prostate cancer. It may be from inflammation or some illness or just prostate enlargement. The PSA is not very specific or precise when it comes to diagnosing or finding prostate. And that leads to some confusion in terms of the interpretation, what one doctor says versus another doctor. And PSA has become somewhat controversial. You'll have differing opinions based on whether it's a urologist, a primary care physician, and it can become quite confusing for the patient. What contributes to an elevated PSA? We talked a little bit about just prostate enlargement can contribute to a normally elevated PSA, but there are a number of other things, and some of the things we just don't know. Obviously, one of the things that we want to rule out is cancer. So that can definitely cause an elevated PSA in addition to enlargement. Other things are activities such as sexual activity. Right before you get a blood work test, that has been shown to elevate PSA in some men. Going for a long bike ride can irritate the PSA, and that can cause an elevated PSA in some men. In some men, doing a prostate exam can elevate the PSA for some reason. Just that manipulation of the prostate exam can potentially artificially elevate the PSA. In a lot of men, those things don't affect the number, but in some men, we think that does. So what else? There are certain conditions like illnesses that can artificially elevate the PSA. And these include infections. So if you had a urinary tract infection, if you had a prostate or testicular infection, oftentimes if a PSA is drawn during that time when you have symptoms, that can be artificially elevated. We think the prostate is inflamed and leaks out a lot of PSA into your bloodstream, that once that infection is eradicated, that PSA should drop back. I think it's reasonable if you have a cold or you have something going on and you have an elevated PSA that's drawn during that time, it might be valuable to repeat it. Other things, if you have a lot of difficulty urinating or you went into urinary retention and you had a catheter placed and the hospital drew a PSA during that time, that can artificially raise a PSA. Like I said, enlargement can cause an elevated PSA, benign enlargement specifically. Some men have a family history. They may tell you, hey, my dad, my uncle, my brother all had PSAs that were high. That may just be the way your prostate leaks PSA into your bloodstream. And lastly, but importantly, is prostate cancer. prostate cancer, again, can be a condition that elevates the PSA. So what medicines affect the PSA? So we know of two medicines that affect the PSA. They're called 5-alpha reductase inhibitors. The names are Proscar and Avodart. The generic names are finasteride and dutasteride. These medicines are generally used for men with enlarged prostates, and these medicines shrink the prostate. So over 3 to 6 months, it will cut your PSA in half. We as urologists adjust for that. So if you had a PSA 3 before you took finasteride or dutasteride, if we were to measure it in about 6 months, that PSA should drop from 3 to 1.5. That would be an appropriate drop. And we as urologists, when we look at your PSA results, in our brains, we'll adjust for that. We'll say, hey, he has a PSA of 1.5 on finasteride. So in our minds, we understand that PSA is actually 3. So those are the medicines that will affect the PSA. And again, those are typically used for prostate enlargement. And then the question becomes, do supplements or diet affect PSA? Well, we don't really know. Most men will not have any significant effect on their PSA from supplements or from diet. But personally, I do think that inflammation, having a highly processed food diet may elevate your PSA. So this is just me saying, hey, exercise, eat a healthy, real food, low or no processed food diet, and I think you can be healthier overall, and that might affect your PSA. I wanted to go over my algorithm, the way I approach an elevated PSA. PSA should be approached in a thoughtful way and not a reflexive way. So this is just how I do it. So if a gentleman came to me with an elevated PSA, typically it'll be a PSA above 4, or again, remember the velocity, a PSA that might have jumped all of a sudden. For example, it went from 1 to 3.5. Talk about his family history of prostate cancer or lack thereof. You talk about his urinary function, whether he might have an enlarged prostate. We talk about his erection function and his overall health. If he's a guy that is on 10 different medicines for severe heart problems and lung problems, prostate cancer may not be at the top of the totem pole. We would do an exam, assess how big or small the prostate is. As a big prostate, maybe it's more likely that his PSA is reflected in just enlargement and not cancer. So an exam is an important component of that. I would look at his numbers, a PSA number, the absolute number, and then I try to find any old numbers that he might have. Is this a big jump? Has he had a PSA 3 years ago and it was stable? He has PSA, he comes in, his PSA was 4.2 and 3 years ago it was 4.5. Obviously, I wouldn't be as concerned. The PSA is elevated, but it's pretty rock steady. Another thing I might do is to repeat the PSA if it took a bump that was kind of unusual for him. Maybe he was sick. Maybe he had a low-grade infection. But oftentimes I'll just get another blood work test and see if that one test that's prompted his visit to me wasn't kind of a one-off artifact of something else going on. If it was still elevated, we talk about other supplemental testing, whether it was urine-based tests or blood work tests or maybe an MRI of the prostate. And then once we put all those pieces together, we'd have to decide if a biopsy was right for him. I think this is a fairly thoughtful and not reflexive approach. As urologists, our goal is to not intervene excessively. We want to make sure that there's no high-risk prostate cancer that might affect his life. And sometimes I think the best thing is just to pull the trigger and do the biopsy, because then you'll know, is there no prostate cancer in there? Is there high risk or dangerous prostate cancer in there? Or is there something maybe very low risk prostate cancer that you don't have to do anything on? So that's my general approach to PSA testing in a man who has an elevated PSA. I hope you enjoyed the video. Hopefully it provided some value and insight. Appreciate you subscribing to our channel and checking out our other videos. Thanks for your time.